Pregnancy is one of the best times for any woman. It is the story of two bodies holding hands on the same journey. A journey that lasts 9 months and is full of emotions and changes, but also of anxieties and worries. It is a new life that is born and grows inside you day after day. What happens to your body during these 40 weeks of pregnancy? What happens week by week? Let's go see it. However, remember that no two pregnancies are alike. The symptoms can be very different from woman to woman and occur at different times. First month. First week. The first week is counted from the first day of the last menstruation, according to the calculation of the management age. From here begins the fateful 40-week countdown, so not from the positive pregnancy test. In the case of conceptional age, it is counted from the first day after conception. In the first week, there are no obvious symptoms that suggest a pregnancy, also because conception has not yet occurred and the embryo therefore does not exist yet. The egg has not yet been fertilized and the sperm has not even begun its journey. Second week. In the second week, which coincides with ovulation, the moment of maximum fertility, the ovary releases a mature egg inside the fallopian tube, where it will then meet the sperm. When the sperm manages to penetrate inside the egg, it will fuse with its genetic material, and the egg will take the name of zygote. A new cell of 46 chromosomes, 23 of which inherited from the maternal egg cell and 23 from the father's sperm. At this point, a series of cell divisions begins and moves towards the uterus, where it will then nest. Third week. There is still no delay in the menstrual cycle, so it is not possible to identify the onset of pregnancy. Meanwhile, estrogen and progesterone levels begin to rise. If their concentration reaches high levels, some women may experience the very first symptoms of pregnancy, such as small uterine cramps, an increase in basal body temperature, fatigue, and headache. Fourth week. Tissues of the embryo begin to form, and thus the production of chorionic gonadotropin, also known by the name HCG, or rather pregnancy hormone, increases. They are the ones that make the pregnancy test positive and can also cause cramps, breast tension, and nausea. In some cases, there may be blood loss, called spotting or implantation loss. They are due to the implantation of the embryo in the uterus and are not to be confused with the menstrual cycle. In the fourth week, your heart starts pumping more blood because it has to do more work, as do your kidneys, as they have to handle more blood. Second month. Fifth week. The levels of estrogen, progesterone, and HCG continue to rise. Your skin becomes smoother and brighter, as well as your hair will look more beautiful and soft. You may begin to experience the typical morning sickness of pregnancy, often associated with vomiting and dizziness. It's called hyperemesis gravidarum and is a disorder characterized by uncontrollable episodes of vomiting and nausea, which can lead to dehydration, weight loss, and metabolic imbalances. Preferences for some foods, repulsions for others, or strong odors may begin to form. It is called gravidic hyperosmia and is due to a greater olfactory sensitivity. Sixth week. Even the mood starts to fluctuate due to hormonal and physical changes. You can feel elated, happy, and full of energy, and the next moment sad and frustrated. You may start to feel pain in your lower abdomen as your uterus grows. Seventh week. The HCG hormones are reaching their peak concentration. You may have gained some weight, but also lost if the vomiting episodes are frequent and intense. You have the urge to urinate more frequently, your legs or breasts become swollen. The glands of the cervix will form a mucus plug that is a thick layer of mucus, which will close the cervix in order to protect the uterine cavity and therefore the baby from the risk of bacterial infections. The embryo is already moving, but being very small, it does not feel in the belly. Eighth week. The uterus becomes the size of a grapefruit and may begin to press on the bladder. You may therefore feel the need to urinate several times. The breast becomes harder and the areola surrounding the nipple becomes darker. The milk ducts begin to branch, from which the mother's milk will then come out. 3rd month. 9th week. The maternal uterus continues to grow in volume and takes on the size of a small melon. You may suffer from rhinitis gravidarum, which is a constant cold, stuffy nose, and breathing difficulties. It seems that the elevated levels of the hormones determine a continuous stimulus of the mucosa, nasal congestion. 10th week. Many women consider this to be the most difficult period, as the symptoms have been going on for several weeks now. You will continue to experience heartburn, nausea, and mood swings. 11th week. In many women, the symptoms of the famous nausea begin to fade. You may notice a bulge in your lower abdomen. Salivation increases, the sense of smell becomes more and more developed, and the gums can become inflamed and therefore bleed more easily. There is talk of gingivitis gravidarum, and it is always due to the increase in the hormone progesterone. 12th week. You may notice a dark brownish line from the navel to the pubis. It is the so-called linea nigra, caused by the hormones of pregnancy, which stimulate the production of melatonin. What happens in the following months? We will see it in the next video.